Hello everyone, my name is Becca, and in the video is my partner Christine here from the Vascular Access team with a demonstration on the insertion of an ultrasound guided IV. Right now, Christine is just getting her supplies ready, which includes a sterile 4x4, a CHG, a large wound tegaderm, that's to cover your probe, a regular IV tegaderm, your J-loop, your flush, and your needle. You can see over by the vein block that Christine has placed the tourniquet as if it were underneath the arm already. Right now, you're going to watch her apply non-sterile gel to the probe and then apply a probe cover. This is very important. You need to always cover the probe when you're doing an insertion. It's also important to note here that Christine is keeping that probe up off the table, off of the patient's bed. It's important to keep that probe sterile, so we need to keep it up away from the area that you're working until you're ready to use the probe. Next, she's going to grab her dressing and get that ready, so when she's finished with her insertion, it's ready to go. Next, she is grabbing her needle. It's very important to have all your supplies ready. We frequently use the 22 gauges because you can use this for almost everything except for, our very rare occurrences of a CTA or something like that. But a 22 gauge is typically all you need. As you see here, she's getting her flush and connecting it to her J-loop. Again, getting all of her supplies ready before insertion so we are prepared. Next, she is going to grab her CHG and she's going to scrub our vein block here. You need to scrub that for 30 seconds and also let it dry. After she's done that, she would put on the tourniquet. Obviously, we don't have an arm here, so she can't demonstrate that, but next we're going to go straight to the insertion. She's going to use that sterile gel, place that on the patient's arm, and she's going to get her needle. Remember, when you're using the ultrasound, there's that center line going down the middle of the screen. That's going to be what you're going to look at on your probe. There is going to be a notch on your probe or a line, depending on what model you have, that's going to show you where you need to insert. You want to make sure to have that lined up on the screen. As you can see, her vein in the center line, and she's going to line up her needle and stick right below that notch. You'll see Christine break skin here, and if you look at that top, you can see her tip going down towards that vessel. It's that little white right there, and then you're going to see her break right through into the center of the vessel. So she's going to move in small movements, as you can see on that screen over there, that she's just barely moving the needle. And I want you guys to follow that needle tip all the way till you're hubbed. Just some very, very small, slow movements so you know exactly where your needle tip is until you're hubbed. You can see that she's going to place that sterile 4x4 under there to catch our blood. You would want to pop your tourniquet before you're going to flush. So she's going to safely pull that needle out, attach that flush, and in real life, she'd check for blood return and flush it. But obviously in this scenario, we're not going to have that opportunity. Next, she's going to clean off that sterile gel. We need to make sure we clean it off well. That way that your dressing is going to stick. She's going to stick her labeled and dated dressing over the site, and then your IV is good to go. All right, I just wanted to give you another view here of watching us follow our needle tip. This is going to help you guys a lot. I think the most important thing is slowing down and really just following that needle tip. Again, to reiterate, I want you moving super slow, millimeters at a time. There's no reason to rush this. You can see Christine up there. Her needle tip is that white spot, and she's following it all the way down. Again, no big movements, just small, tiny movements until she gets all the way down to that vessel. We're just going to continue to watch her needle tip until she breaks through, and you'll be able to see her inside the vein. But she doesn't stop there, okay? We're in the vein. We're going to have a flash of blood return, but we're going to keep going, okay? You're just going to follow that needle tip all the way until you're hubbed. That way you're not going to go through the bottom and you're going to have a lot more success. Next, we're going to go over how to assess the veins, and when you're choosing a vein, you need to not have the tourniquet on. I'm going to show you here the difference. So right now, the patient doesn't have a tourniquet on. We can see that the vein isn't quite down 1 centimeter. It's a little less than that, which is what we want. You don't want to choose a vein that is more than 1 centimeter down, because that's not going to leave enough catheter in the vein, and that's going to be really prone to infiltrations. So it's very important that when you're assessing your vein for use with the ultrasound, you don't have the tourniquet on. So this now is the same vein. You can see that it's much larger and it's a lot closer to the skin. So now we can see that with that tourniquet on, it's going to change the way that the vein looks. This next one here, we can see that is at 1 centimeter. That is the max depth you want to use with the ultrasound. But then here in a minute, it's going to show you with the tourniquet on, and you can see how much of a difference it makes. Look how large that vein looks now. That vein looks like it could handle a 20 gauge, but that's not really what the vein is going to look like at rest.